Next day of budget workshops, and we are happy to be starting with our health department. We have Director Stephen Williams and also Darren Asher. Welcome to the Horseshoe, and we're being joined by Councilmember Willie Davis, Kate with Councilmember Abby Kamen's office, Bradley with Councilmember Mary Nan Huffman's office, and Edith with Councilmember Joaquin Martinez's office, and Councilmember Julian Ramirez are here, and I expect more will be coming in, but don't want to, we've got a full day ahead, so want to go ahead and get started. Our friend Sarah, we are back today from the Korean community, and we're glad to see you. Thank you for the health department. I know that we've shared page 20 of this presentation, which is a summary of the expenditures in Korean with you, and we also have a Korean translator who will be online today as public commenters want to come up and speak. I'm also joined by Councilmember Twyla Carter. And with that, we will go into the health department budget. Thank you.
Good afternoon, and thank you for the time to present our budget to you. I'm going to go straight to our department's org chart, where I would use this as an opportunity to introduce the staff that's present with me. Starting is Judy Harris, who's the Deputy Assistant Director. Next to her is Tucker Wilson, who's a Deputy Assistant Director of Communications. Next to her is Roger Seeley. Roger's Assistant Director over Environmental Health, Public Health Surveillance Services. And Naomi Macias is Assistant Director over Community Health Services. And next to her is Patricia Watson. Patricia Watson is the Assistant Director of Maternal and Child Health and Family Health Services. And Amber Haig is sitting next to her, the Deputy Assistant Director. I think it's important that you recognize these faces because this is the leadership of the Health Department and the folks that are actually doing the work. David Peirce, who is our health authority, is not here. He's actually participating in this citywide call today. On slide 4, what you will see is really our budget and functional summary. I think this slide really illustrates the complexity and the diversity of our funding by areas of focus. You label them as programs. We call them areas of focus because our program, under each one of these areas, there are several programs. I know there's always been an interest in whether we seek additional funding. The reality is that the general fund only covers about 33% of our total budget. We could not have the depth or the breadth of the services if we were not aggressive in seeking additional funding. Please understand that when we get grants, it is the funders who actually dictate the outcomes and how we actually run the programs. To put that in context, we have about 91 grants, 1,600 staff, and we have about 35 buildings under which we provide services. If you go to the next slide, and I've been presenting this slide to council over the years, it illustrates the city's net general fund investment in public health, which is around $39.8 million. And really, if you subtract the restricted accounts, which we have no control over, that means that reduces that investment to $31 million. Our total budget is about $200.7 million, including grants. So really, if you subtract that restricted accounts, the city's investment in our total budget is around 26.9%. Going to the next slide, the strategic guidance alignment, it really gives you a visualization, of our total programs. Really, during our pandemic, it really demonstrated the need for to be involved in public safety and quality of life issues. A lot of times when people think about the health department, they think about our clinics and our individual interactions with people. Well, the reality is that the services involve individual encounters and interaction, but the outcome is about the protection of the general public's health and safety. The impact to broader populations is the impetus for why we provide those individual services. The next slide, you see expenditures by programs. The slide will focus on these individual programs or areas of focus, which I told you. Overall variance explanations in FY24 estimates are lower due to the hard-to-reach vacancies. A lot of our clinical staff and some of our more specialized staff, we're looking at, the actual pay associated with that and recruitment efforts because that is challenging. The 2025 budget also assumes that the vacancies will be filled and include increases in fringe benefits.
Excuse me, Director. We have been notified that the audio's not working on Teams. I would just suggest that if you're trying to watch via Teams, if you could switch to HTV, it is working there, and we're trying to work through the issue. Thank you.
I was watching y'all on HTV as I was riding in this morning. In terms of spending also, in environmental health, that includes the new firearm safety dashboard, and family health and human services. The includes an increase of $2.3 million due to the new opioid abatement services program that addresses opioid crisis. It also includes a budget for contingency with health centers related items that are not covered in the general fund. What that means is, y'all, sometimes we really have to use those funds to pay for armed security services for our health centers, some supplies, sometimes staff for our oral health and emergency responses. The next slide is revenue by programs in terms of thousands and the changes associated with that. There was a 39% change in administrative services, and that was primarily due to indirect cost revenue. The way that works is our indirect costs, which goes directly from grants, which goes directly downtown, it's really based on the amount of personnel that's associated with that grant. And as you know, we are going to have less staff associated with grants because of the reduction in the COVID grants. And we're going to lose about $2 million in revenue associated with that. In disease prevention and control, the 2024 estimate is higher because it includes a one-time prior year revenue in the Medicaid administrative claims. What that means is that we were paid, that was booked, 2 years were booked in 1 year. And in family health and human services, the 2024 estimate is higher because it includes the new opioid abatement fund. One of the settlements was paid in full, which provided about 37% of the expected revenue up front. Now the summary of programs. Number one is administrative services. As I said earlier, the administrative services provide supports for 1,600 employees, 36 buildings, 180 vehicles, 91 grants. You really have to be really close to the grants and the management of grants to understand the amount of administrative support that is absolutely necessary to support the number of grants that we have. As a matter of fact, one of the processes that we have put in place is determining whether or not we will actually go for certain grants, because a $50,000 grant might not be worth it because we might have to provide $75,000 in administrative support to that $50,000 grant. Of the $24 million in administrative services, approximately $8.1 million is in restricted accounts. And I keep mentioning that because we have no control over those restricted accounts. And as I said before, the $16 million is used to provide those critical administrative support services. And I always like to use this number. The administrative cost is really under 10% of our total budget. If you exclude the restricted accounts, the cost of our administrative support services is about 5.6% of our total budget, which is really good. I mean, when you're applying for grants, especially from foundations, one of the things that they want to see is how much money is actually going for services. And so most of our money actually goes for personnel and indirect services. In reality, we've had to augment the amount of money that is supported, that is actually set aside for administrative services. We've had to use 1115 waiver money for that. And the reason for that is that we did not have enough money in HR services, IT services, our quality assurance function and compliance function. And one function that is really critical to our health department operations, especially during a response time like this, is the logistical support and contracts and procurement. What that means is that we're actually using 1115 waiver dollars to support what our core support services for the health department. As I've said, in every one of the budgets that I've presented after 2011, is that we really have to be mindful that this 1115 waiver money, which is setting into an account, will run out. And I'll talk about the programs that it'll impact later. Program 2 is environmental services. Of course, we generate a number of quite a bit of revenue in environmental services, and we have been relying heavily on consumer health special funds, which is our FOG program, to fund a lot of the environmental health operations. In this case, one of the things that we had to do this year is dig into our 2010 funds, our 1115 waiver funds, to get $366,000 so that we can continue to draw down and environmental services. And we have been relying heavily on consumer health special funds, which is our FOG program, to fund a lot of the environmental health operations. In this case, one of the things that we had to do this year is dig into our 2010 funds, our 1115 waiver funds, to get $366,000 so we can continue to draw down. I hear my voice, so please cut it off.
On a second, let's get that corrected. You want to make sure we know about that 1115 waiver. We got it.
You know I'm going to drive that point home. I will.
HTV,
I will continue
that
to
was
do
divine
that.
intervention. Yeah. Okay. Thank you.
I do not like hearing my voice.
Hold on.
Okay.
He's really making.
Are we finished? Well, the point that I'm making in this case, related to the 1115 waiver, we were getting about $8 million in lead abatement dollars. And you know housing is a really critical issue here. And this is about safe housing. Because I did not want to see us miss the opportunity to draw down $8 million, we figured out how to provide those matching funds. Those funds have traditionally been supplied by our housing department. I have a meeting with Mike Nichols, and I'm asking him for the money back, quite frankly, because I think that is certainly a part of housing. I mean, safe housing has always been important, and for decades, that those matching dollars have come from that source. The third program is disease prevention and control. What a lot of you might not know is that we're the designated entity for reportable diseases, and there are about 80 reportable diseases that healthcare providers have to report to us. Most of the activities outside of our clinical activities in this area are actually supplied by grants. Of the $72 million that's spent on communicable diseases in the department, only about 5.4% is provided by the general fund. Almost all of epidemiology, which is our disease detective, is supported by grants. In this case, in this area, I mentioned the 1115 waiver again because we're providing over $1 million in support for TB services. If you look down at the performance measures, because in our 5% cut, we will no longer be providing services at our CASA location. You will see a decrease in the number of people that are served. Our overall capacity could actually absorb those clients, but because we know that there are transportation challenges in Houston, we're likely to see a decline. The next program, Reentry and Youth Violence Prevention, we had really a special meeting related to My Brother's Keeper and Community Reentry Network. These are strategies that are address and reduce negative interaction and outcomes with law enforcement. There are no general funds that are allocated to these initiatives. All of reentry and violence prevention are funded by the waiver and our grant funds. We're paying for my special meeting related to My Brother's Keeper and Community Reentry Network. These are strategies that.
Got it. Keep going.
Okay. We're paying for My Brother's Keeper infrastructure, the redirect program, the Community Reentry Network, communities and schools, youth leadership program called XY Zone, MBK Systems of Care, which is a contract with Harris County Resources for Children and Adults, and our Urban Scholars Program, and the Social Justice Learning Institute. All of these are paid for by 1115 waiver dollars. We did get some ARPA dollars for credible messenger and violence interrupter programs, and we're hoping that those contracts will soon come to council. Our fifth program, the multi-service centers, which all of you are familiar with and now are serving as cooling centers. This is where we house various Head Start programs, daycare programs, libraries, WIC, the Mayor's Office of Special Events, our Diabetes Awareness Network, and services that are provided by a variety of community partners. They also serve as sites for community events, community meetings, and they are also strategic voting locations. Each multi-service center has exercise equipment to promote access to physical health care. The $3.0 million is primarily spent on personnel. There's no funding for programs associated with our multi-service center other than the Diabetes Awareness Network, which is at our ALEAF program. As you know, in the event of disasters, these multi-service centers are designated to provide relief to the public, such as warming and cooling centers, as well as food distribution. Program 6, Family Health and Human Services. In this case, the general fund primarily supports client access and care coordination. We operate 3 congregate meal sites in-house at our multi-service centers too, but the funding for those programs are actually provided through our area agency on aging. Our client access service links uninsured people with medical coverage and finance assistance programs. Lack of access to basic needs like food, insurance, utilities impact people's ability to be healthy. Care coordination helps clients access the services that they need. Going on to the next program, and our last program is chronic disease, education, and wellness. Although chronic disease is the leading cause of morbidity, we have very limited general fund or grant funding to support these activities. We have a substantial investment at 1115 funding for chronic disease programs. Now, our ALEAF DON program is actually funded by the general fund. But just to tell you why it's important, according to the CDC, 6 in 10 adults in the United States have a chronic disease, and 4 in 10 have 2 or more. Although chronic disease is the leading cause of death and disability, we have very limited funds in chronic disease. Going on to personnel versus non-personnel, the next few slides show the breakout of personnel versus non-personnel. As you can see in this slide, our FOG program has a larger contribution towards equipment, vehicle purchases, and contracts with special waste disposal vendors. And Fund 2022, or Health Special Revenue, is used primarily for contracts and supplies and equipment. This fund contributes to several of our programs, such as our Vital Records program, environmental health, veteran services, and our Medicaid administrative claiming, to name a few. Really, it's kind of a hodgepodge of programs that are actually funds that are from various programs that are put into this. On to the next slide, personnel versus non-personnel. Fund 2008, our lab is primarily used for supplies and services. Fund 2009, the swimming pools have personnel contracts and vehicle equipment. And the program that I've talked a lot about, 2010, Essential Public Health Services, is primarily personnel and contracts. I think there are about 178 people that are supported by that. On the next slide, Houston opioid abatement. As previously stated, this is about addressing the opioid misuse. The majority of this funding is actually going to contracts and services that offer evidence-based treatment and peer recovery services. Expenditure by fund. The next chart, it highlights the expenditure activity of our general fund and special funds. A breakout of those, if you turn to the next page, is you will see the breakout and the detail of that associated with that. As you can, excuse me, you know, we had to experience a 5% cut in our general fund. I wished I could have that money back. In our health special revenue fund, the increase is directly related to an increase in the number of clients that are served by Veterans Affairs. So our pay is actually associated with the number of people that we serve. Swimming pools and special waste decreases include reduction in personnel and vehicles that were received in the prior year, which means that we got those, and so therefore expenditures would be less this year. And our Central Public Health Fund, 1115 waiver and charity care, includes a contingency fund used to ensure that we have capacity in situations where we have to have a response. As I said before, this fund also is used for programs like reentry, See to Succeed, chronic disease, our quality assurance team to actually review the department's processes and policies and standard operating procedures. We also have a significant amount of support for our communications function as well as our IT services. That fund covers 179 staff people. And lastly, revenue by fund. The chart highlights the revenue activity of our general fund and special funds. And if you turn, you will see that in detail, the revenue by funds. And the revenue highlights, which is the last slide, as I stated earlier, it's primarily, the reduction is primarily due to the reduction in COVID-related activity. What we're going through in our department, we recognize during COVID that some of the functions that we brought up during COVID are absolutely necessary, such as enhanced capacity in IT, enhanced capacity in our communication services, and actually a need to have a more structured capacity for response. As an example, we are now, in May, and my staff has been activated twice, and we're not even in hurricane season. And so what we're trying to do is to really build that capacity to really have response capacity and more of a routine basis, just because of the frequency of times that my staff has had to be activated. And that's it for my presentation. I'm open for questions or discussions.
Thank you. Staff from Councilmember Huffman.
Yeah, thank you for your presentation. I just have one quick question. Does the health department contract with Harris County Public Health for mosquito control? And if so, does the health department have a say in which areas are targeted?
No, we don't. Actually, mosquito control, as I understand it, is actually a separate taxing authority, although you don't really see it when you look at the county budget. No, we don't have any control over that. I would want to know whether or not there's some interest in our influencing that. It can be controversial. I mean, I've done this in other jurisdictions because some neighborhoods are open to it, some neighborhoods are not so open to it.
I'm open to it. The mosquitoes are bad out there. Councilmember Ramirez.
Thank you, Madam Chair. Director, I didn't quite understand that 1115 waiver program. Could you give us an overview of that again?
I should ask the chair to do it since I've
It's been going on a long time.
Okay, back in 2011, the state presented an opportunity for health departments to actually access money that was usually set aside for Medicaid. It was called a Medicaid waiver program. We proposed several programs under the 1115 waiver program, about 13 programs. We were able to bring in an additional $30 million because of the performance on those 13 programs. The way that we were reimbursed was related to the value of the program, not the cost of running the program. And so we were able to set up a fund that was used to run programs even past the lifespan of the program. That's why you hear me say the monies are going to run out, because there's no, the waiver is over now. And so what we've been doing in the last couple of years is trying to figure out other funding opportunities to replace some of that money, because we recognize that in this case, the general fund is not covering what I would consider essential support services or direct services within our department. For example, our IT services are significantly underfunded, and so we use money to supplement that. There are some programs, like our tuberculosis program, that is primarily funded by the general fund, that is underfunded, and so I've used the 1115 waiver to round out the funding needs for that program too. There are some programs like our See to Succeed program, our community reentry program, our My Brother's Keeper program, that we've funded with 1115 waiver that we should, of course, I would advocate for continuing them. The good news is that in the last couple of years, we've been able to replace some of that funding source by the charity care program. And staff, Amber, who's sitting back there, was instrumental in this. We were able to draw down an additional $10 billion through the charity care program, but that's going to end in 2030. And so what we're doing is trying to figure out how we can replace those dollars to continue those programs. I mean, for example, in our reentry program, that is something that I would say that you don't want to not continue when you compare the recidivism rate of people who graduate from that program with the recidivism rate of folks that are out of prison 3 years later who don't participate in that program. And so I know you've been here, some of you have been here for a while, but so over the years I've continued to state we need to figure it out. That doesn't mean that we're not working on it as a department, but I don't want actually y'all to come back and say, well, we didn't know this. So
has that program officially come to an end already?
Yes, it has.
And do we have any money left over then?
Yes.
And how much is left over? I'm just curious.
About 40 million.
About 40 million.
40 million, okay.
And we're projecting that maybe we could last 3 years, maybe not longer. It all depends. Because as I said in my presentation, there are things that come up that we have to pay for because I would say that there's more value in us using that money to do it. The example that I gave you earlier was our lead program. I can't say that I would idly sit back and watch the city lose $8 million in lead abatement dollars because I lost a funding source in housing. So I told Darren, find the money. We'll do it. We'll try to make it up some way. But why would I let $8 million go out of the window because we couldn't find $300,000?
Okay. Thank you.
I'll put you back in.
Okay.
Okay. Councilmember Flickinger.
No, that is the Community Reentry Network program. I've changed the name, it's too long. It's really our reentry program. This is where we actually enroll folks who are coming out of prison and take them through a 12-week or more curriculum, really looking at things like anger management. A significant part of the program also includes helping people prepare for jobs and getting them employment. For example, we've been able to work with Union Pacific and get at least more than a half dozen of our folks employed by them, starting off at $70,000 a year. Yes, we run it ourselves.
Mike, put your mic on, please.
Sorry about that. I see in your budget this year you were budgeted for just under $100 million for the year for 2024.
No, our general fund budget is what, 54 million.
Okay, but with all the abatement funds, special waste, all that, is that not correct?
Which
slide 20?
Oh, you're talking about everything, yes. Slide 94. You're talking about the first slide. Slide 20. 20. Slide 20. You're talking slide 20?
Yes.
Yes, the answer is yes, if you're talking about everything, yes.
Yeah, and out of that, you're going to spend just under 85 for the year?
You're talking about the current year.
Yes, 24.
Yes, and I gave an explanation for that. We have a number of hard-to-fill positions that we know that we're not going to fill by the end of the year. And so when we do the next budget, we still include those vacant positions with the hope that we will be more successful in filling them the next year.
Is it possible that we don't need some of those positions?
Anything is possible, but it ain't likely.
Okay. But you feel like you're able to operate today fine, or?
No, absolutely not.
Okay.
No, I'm not. You know, I'm sorry. I've probably been here too long, and I've heard this too long. But the answer is no. I know when you look at this and it's fresh on you, that seems like it's logical. And from your perspective, it is. But from my perspective, I'm looking at what we're not doing that I think that we should be doing.
Okay. Good enough. And that's why I'm asking you.
I know, that's fine.
You're the guy.
You know, actually, I told my deputy, I said, oh, we're going to have a lot of new council members. I know what this is going to be like. I've gone through this about 4 times. So, yeah, logical question, but the answer is no. If you ask me as a director, and I've said this, and Chair, you've heard this from me before, the city does not support this department to the extent that it should. This is the 4th largest city in the country. And if you even look at what is going on now, and you look at your expectations of the health department, your investment is minimal. And if it were not for grant funds, and in this case, if it were not for the creativity and the diligence of my people in drawing down the $30 million, we would be in hot water. Because I've basically been depending on a savings account to keep the department afloat and to be flexible enough to do some of the things that you're seeing now, especially during this time of crisis.
Okay, you can put me back in
As
the
you
queue.
can see, I'm a little bit
Sure,
passionate
I'll put you
about
back
the
in,
deal.
and I will confirm, they have been very creative about revenue replacement and drawing down funds from other places. And I do want to welcome Vice Mayor Pro Tem and Councilmember Joaquin Martinez, did I already say that, and staff from, Dee Dee from Mayor Pro Tem's office. And staff, Veronica, I think you're on from Councilmember Plummer's office. And Fred has been talking, and he is here in the chamber, so recognizing Councilmember Fred Flickinger. Okay, next I will have Councilmember Ramirez.
Okay, Director, a few more questions. Does the department participate in the Meals on Wheels program?
We fund the Meals on Wheels program.
Okay, and what?
Through our area agency on aging, it's actually a grant.
I see. And how much is provided by the city through that grant? Or roughly, if you know.
I don't know the specific amount. But
Okay.
the grant itself, the overall area agency on aging grant is about, I want to say over 12 to 14, $13 million. But not only are we providing the Meals on Wheels, we are funding the senior nutrition programs, which are run by Baker Ripley, and we have 3 in-house programs that I mentioned. What you don't see is that we provide access to services for seniors like dental services, eyeglass, transportation, some legal services. I think I signed off on an item that's coming to council for one of our contractors.
Mm-hmm. Okay. We'll look for that. And I know the city has some clinics as well. Do you know about how many clinics we have?
We have 3 clinics.
3?
When I started, we had 8. Due to budget reductions, reduced them to 4. Currently, we have 4. I'm sorry. Somebody should have corrected me. Once this budget is passed, if it's passed as is, we will be providing services out of 3 clinics.
Mm-hmm.
I get uncomfortable with that, not because the capacity won't be there, but as I mentioned earlier, it is hard to get from one side of town to the other to access clinical services. And I know people are looking at efficiencies or whatever, but we have to factor in challenges like that. In this case, there are likely to be some people that are on the near north side that won't access these services because of transportation challenges.
And what, do you know the operating costs of those 3 clinics that we'll have?
They're about $10 million each.
Each of
About $10 million, sorry.
For
About
all
$10
of
million
them, 10
for all of them.
yeah. All.
And let me ask you, employees have shared with us a couple concerns regarding sort of the mobile units when y'all go out in the community, and I know you do that a lot, but sometimes, for instance, you might have an activity where gift cards are given out, and there's been expressed to us some concern about personal safety in some of those instances. Is there anything that can be done to address those concerns?
There will be if they brought them to me.
Okay.
You know, we had that issue during COVID, but we also had police presence at a lot of our sites where we were doing that. So I haven't heard that concern past the not in terms of our routine. So
Okay.
if they are, they should bring them to me.
All right. Glad to hear that. Thank you.
Councilmember Flickinger.
I agree completely with your concerns about people traveling in order to get to the facilities. I mean, typically I would think the community you're serving would probably have the least availability for transportation, so that makes sense. Are the mobile units able to take care of that?
In some cases, they do. We have units, particularly for immunizations and for special efforts. Like, for instance, we're in the middle of a challenge related to syphilis, and so we go to special venues to provide service. So the answer is yes, to some extent.
I mean, I would almost think in some degree that the mobile units would be better than a fixed facility. Obviously, you're not going to have all the options available to you at a mobile unit, but you would actually be in the community rather than...
In some cases, that's true, but it all depends on what you want your volume to be. I mean, if it's a high volume, if the expectation is related to high volume, then you would want a fixed site or you would want a building to operate in. For example, when we were doing targeted outreach for MPOX, we would pick specific venues. We're speaking about staff's concern. I know that, you know, we were operational during the heat of the summer, and it wasn't really ideal, and so it was better to go into a fixed site.
On your recidivism rate, can you send me the information on that? I'd like to take a look at that. I'm involved with some stuff with that. And
Be more than happy to.
Okay. I appreciate it.
Yeah.
Okay. Thank you.
And Councilmember, if you get the opportunity to go to one of the graduations from this reentry program, it's probably one of the best things I've been to in the city of Houston.
Yeah, I spent a lot of time with Pat.
Yeah.
Very similar.
Yeah.
It's very good.
Great. Kate with Councilmember Kamen's office.
Thank you. And Councilmember Kamen is so sorry she couldn't be here today. She's coordinating some emergency assistance right now. First, I want to thank you for all that you and your staff do. We're always impressed, and even always during disaster, we got to spend some time with your health department staff at West Gray, and they were doing an incredible job. They were also taking 311 cases, helping them file them on water quality and stuff that ranges far beyond the immediate disaster. My first question is, we've been working with your staff on what I understand to be a successful program to provide period products for free in the bathrooms of your health centers. And my question is, does your proposed budget continue to secure the funding to maintain that?
Yes.
Thank you.
I'm looking at Darren because if it doesn't, I'm going to push him out of the chair.
And I see a lot of nodding from behind you.
Councilmember Ramirez.
Let me raise with you another item of concern that's been brought to our attention by employees, and that's when mobile units go out into the community, it seems like it's often the case that bathrooms are not very accessible. Anything you can think of to try to address those concerns?
You know, Council Member, you're repeating a discussion that I actually had with the union folks. They brought up the same issues you're bringing up. And one of the things that I encourage them to do is to come and talk to us because some of the things that they mention were not necessarily appropriate. One of the things that I told them is that when people sign up to work in the health department, there are two things that I try to stress. One is, this is your regular job, on a routine basis. But at any time, you might be asked to do something else. Certainly, I don't want my folks inconvenienced. I don't want to put them in unsafe environments. But in public health, we have to be mobile and we have to be versatile. What I'm willing to do is to sit down and to talk to them about that situation, and we will figure it out. I got a smart staff. We will figure it out. We are very close to the police department. If there are any concerns about safety or whatever, I have Larry's personal phone number. I can guarantee you that at least 4 people in that row back there have the commander's phone numbers where we can get an intervention or we can come up with something. But it's one of those situations where you need to really talk with staff and really kind of work it out. But I will tell you that we will be mobile because that's just part of our job. I started public health in the middle 80s, and I had to convince public health nurses back then to carry phones with them because they were going in all kinds of places. Part of this is how people even present. And I'm willing to talk and I'm willing to work with staff, but, the sky's not falling, and I can tell you that. And if my folks know that they don't have to present in a situation where it is unsafe. And they do have avenues. They can come and talk to me, and they can come talk to the staff. And I did hear everything that you're bringing up. I met with the union leadership, and they brought these issues up to me, and we had a discussion about it, and we said we'd follow up with it too.
So the union has come to you then and talked about these two issues? I set up a meeting with the union leadership because I wanted them to know who we were, how we operate, and what we're about. And they have new leadership, and so I invited them into my department. These were the issues they brought up. And so what was done to address them?
We only had an initial meeting. I invite the staff to have those concerns to come and talk to us or talk to their managers about this. And we will resolve it.
All right, so it's something you're going to work on with them?
Yes.
Okay.
My staff have total access to me if they choose to exercise it.
All right, and can we just finish off that
Sure,
point?
go ahead.
I'm glad to hear that, but let me make clear that no one has expressed not supporting the mission of the health department or not going out into the community or anything like that. Okay, so I'm just relaying to you some concerns that we heard, and I hope you will sit down with them and try to work through these. Thank you.
I'm willing to do it, but they have to bring it up.
Councilmember from Kate Dentler with Councilmember Kamin's office.
Thank you. I understand that the health department secured the funding for the gun violence data integration, tracking, and dashboard project that Councilmember Kamin put forward. Can you publicly confirm that that's still moving forward?
I agree with Melissa that we would eat the cost of that.
Thank you.
You heard how I said that, right?
Yes, sir.
I didn't get extra money, but I'll eat the cost of it.
Okay. Director, I have a number of questions, but in the interest of time, I'll submit most of them in writing. I did want you to touch briefly, and I know you and I have met about this, but on the interlocal agreement with the county that was passed February 13th of 2023, and specifically the coordinating council, and if any work has been done to establish a coordinating council between the Harris County Public Health and City of Houston.
I had a conversation with the Mayor's Chief of Staff, Chris Newport, and what I committed to do was to reach out to Director Robinson and have a one-on-one conversation with her about how we can move those things that were outlined in the interlocal forward. I'm not against doing it. I know sometimes y'all think I'm not, but I'm not against doing it. But there are some concerns that I do need to address, and I think it's best that she and I talk and really try to work that out.
Understood. And part of that ILA was an annual update. We're past the annual update time. So I hope that meeting happens and we can get some further direction on that. I'll submit some other questions in writing. Councilmember Flickinger, back in.
Can you go back and elaborate on the gun violence? I wasn't aware of any of that, and I'm kind of curious what it cost you and what it is you're going to be doing.
There was a proposal. I think it's a collaboration with Rice. I think Councilmember Caveman's office could probably explain it a little bit better than me.
I don't have it immediately pulled up, but I can send you all the information on that, like in 5 minutes.
Thank you.
Gun violence actually is a public health issue, and so it's something that's consistent. And we're willing to work with folks that have some level of expertise in it.
Do you have any idea what it'll cost you to do this?
I think it was $200,000.
I believe that's correct.
Okay, that seems to be it. We have a number of public speakers. Thank you, Director. Thank you so much to all of you and everybody in the health department through another disaster. You guys are always there on the front lines, and we are very, very grateful for your help and good work for the residents of Houston. So thank you very much. Okay, on the translation, there has been some issues. We set up the Korean translator that could only participate virtually today. And again, this is being funded from my office, this translator. We had it yesterday for the housing, and we're having it again today. Unfortunately, she is having trouble connecting or hearing, so there's some issues. The health department did translate some of their presentation. I know Sarah has gotten that to the group. I really apologize. You guys have highlighted a lot of these struggles with language access, and I am very grateful for that. And we are seeing firsthand how it's not a perfect world, but we will do our very best. Yesterday, you had written English translations, and you have those again today, so we will, colleagues, be able to understand what they've been sent out also via email, Jordan tells me, so we will have the benefit of your comments and the translations, and I apologize for this imperfect situation. We will try to make that better in the future, and I do want to make sure and welcome my Vice Chair, Mario Castillo, to the chamber. So we will start with public comment. First, I have Stephen Wu. He's not here. Sarah Saeed. Each speaker will have 3 minutes.
Hello again. My name is Sarah from Woody Juntos. I serve as the senior community organizer. Today, you'll be hearing from Korean-speaking seniors, again, from our community, many of which who were impacted by the recent inclement weather we recently had. I wanted to just point out to this body, after hearing a little bit about the Houston Health Department workshop, just some of the key things that are pointing out to us. Just access to services, political voice and socioeconomic status directly affect disaster risk and resilience. Key factors include limitations in healthcare, public transport, communication, infrastructure, as we've heard today. We are hoping that the City of Houston takes all of the feedback that is taken into that is given today to reinvest into the Houston Health Department, because as it seems, they are really dependent on grant funding. We hope that there is an expansion of mobile units, that the proposed budget secures funding for bilingual staff support amongst the Houston Health Department, that the emergency response and crisis intervention includes language accessibility as a core support service, as a direct service, and just keeping in mind, recovery after an emergency disaster is uneven in communities. People with the least resources often are at the greatest risk from extreme weather. And so keeping this in mind, when we hear from community members today, I hope these are some of the things that you take into consideration when making important decisions about this budget. And with that being said, I'm happy to interpret today.
Great, thank you very much. Our next speaker will be Myung-Suk Yu.
안녕하세요. 우리 훈터스 시니어 팀의 유명숙입니다. 올해 남편이 메디케어 신청 자격이 됩니다. 생일 3개월 전후라는 걸 알면서도 영어가 안 되니 차일피일 미루고 있습니다. 언어 스트레스 때문인 걸 알지만 코앞에 닥칠 때까지 시간을 끄는 남편이 날 속 터지게 합니다. 저희 엄마 살아계실 때는 골드카드를 받는 한국 의사가 없었습니다. 진료 시 통역을 세워서 의사와 상담을 해도 답답해 하셨습니다. 그래서 어떨 때는 한국 의사에게 한국말로 다시 진료를 받고 오셔야 병원을 다녀온 것 같다고 마음 편해 하셨었습니다. 일하면서 병원 가는 시간과 비용을 이중으로 부담하는 나는 짜증이 났지만 어쩔 수 없었습니다. 저희 남편처럼 영어가 안 되는 분들을 위해 메디케어 및 모든 의료 관련 신청을 위한 한국어 안내 전화 서비스와 신청서 및 병력 기록 양식을 한국어로 가능하도록 휴스턴시 예산을 조정하여 책정해 주시기를 요청드립니다. 감사합니다.
My name is Myung-Suk-Yu, and I work as a senior fellow at Woody Juntos in District A. This year, my husband will be eligible to apply for Medicare, even though he knows the deadline to apply for Medicare should be 3 months before or after his birthday. He's putting it off every day because of his language barrier. Even when my mother was alive, there were not enough Korean doctors who accepted the gold card. Sometimes doctors spoke with her using Korean interpreters, but she still felt frustrated. She would feel more at ease when medical treatment was received from a Korean-speaking doctor. I spent much of my time working in order to pay doctors' bills, however, was never satisfied with the gaps in language access. For those who have limited English proficiency like my husband and mother, I asked the City of Houston to allocate funding, increase funding to the Houston Health Department budget to provide free workshops with interpretation in person to help Medicare and medical-related applications easier, make it easier for them. And I also ask that they provide all applications and medical record forms in Korean, both online and by paper. Thank you.
Thank you very much. Paul Kim.
안녕하세요. 우리 훈토스에서 봉사하고 있는 시니어 펠로우 폴 킴입니다. 고령 노인 인구의 빠른 증가 추세와는 달리 이들을 적절히 돌보고 지원하는 대책과 시설들은 턱없이 부족한 현실을 안타까워하고 있는 이들이 참으로 많습니다. 예전보다 오래 살게 되면서 긴 노후 생활에 대한 걱정이 커지고 의료 비용 역시 가파르게 오르고 있는 추세를 고려할 때마다 막상 큰 병이 나면 어떻게 헤쳐나가지 하는 생각으로 눈앞이 캄캄해지곤 합니다. 현재 휴스턴에도 노인들을 위한 좋은 의료 인프라들이 많이 제공되고 있는 것으로 알고 있지만 이용 자격의 제약으로 문턱이 높은 데다 제한적인 언어 접근성은 물론 서비스 비용도 서민층에 속하는 노인들이 감당하기엔 벅찬 실정입니다. 이러한 상황에서 어포더블 시니어 돌봄센터나 요양병원 같은 공공의료시설들을 확충하여 고령 인구들을 케어하기 위한 대책들을 마련하는 일이 매우 시급해 보입니다. 앞으로 노인들을 위한 의료 현황에 지속적인 관심을 가져주시고 예산 배분을 위한 재조정의 기회가 주어진다면 노인 의료시설 확충에 전폭 인상된 예산이 책정될 수 있도록 힘을 모아주실 것을 정중히 요청합니다. 감사합니다.
My name is Paul Kim, and I work as a senior fellow at Woody Juntos in District A. Contrary to the rapid increase in the elderly population, many people are lamenting the fact that measures and facilities to properly care for and support them are insufficient. As people live longer than before, concerns about their longevity are growing, and considering the steep rise in medical costs, the worries of how will I get through it, and when I get sick often fills my mind. Although many seniors receive Medicare benefits, the burden of old age medical expenses, which are still difficult to afford, show no signs of being easily resolved. I know that good medical infrastructure for
As
the
people
elderly.
live longer than before, concerns about their longevity are growing, and considering the steep rise in medical costs, the worries of how will I get through it, and when I get sick often fills my mind. Although many seniors receive Medicare benefits, the burden of old age medical expenses, which are still difficult to afford, show no signs of being easily resolved.
They usually
I
catch
know
it
that
quick,
good
but
medical
we'll get it.
infrastructure for the elderly. Oh.
Continue, thank you.
I know that good medical infrastructure for the elderly is currently being provided in Houston, but the threshold for use is high due to restrictions on eligibility, limited language access, and service costs are too much for the elderly belonging to the working
They
class
usually
to
catch it
afford.
quick, but we'll get it.
In this situation, it seems very urgent to prepare measures to care
Continue,
for the
thank you.
elderly population.
I know that good medical infrastructure for the elderly is currently being provided
really
in
apologize,
Houston,
you guys.
but the threshold for use is high due to restrictions on eligibility, limited language access, and service costs are too much for the elderly belonging to the working class to afford. In this situation, it seems very urgent to prepare measures to care for the elderly population.
Really apologize, you guys.
We'll try again. In this situation, it seems very urgent to prepare measures to care for the elderly population by expanding public medical facilities, such as affordable senior care centers and nursing hospitals. We respectfully request that you continue to pay attention to the current state of medical care for the elderly in the future and try to ensure that a fully increased budget is allocated for the expansion of elderly medical facilities if given the opportunity to readjust budget allocation. Thank you.
Thank you very much. Myung Jae Kim. Oh, I apologize.
To the current state of medical
Mr.
care
Kim,
for the
please
elderly
come
in the
back. I
future
had Vice
and try
Mayor
to
Pro
ensure
Tem
that a
Amy
fully
Peck.
increased budget is allocated for the
Okay.
expansion of elderly medical facilities if given the opportunity to readjust budget allocation. Thank you.
Thank you very much. I have a comment from Myung Jae Kim. Vice Mayor Pro Tem
Thank
Peck.
you, Chair. Sorry about that.
Oh, I apologize.
I just wanted to say
Mr.
to
Kim,
everyone
please come
who's-
back. I had Vice Mayor Pro Tem Amy Peck.
Can we just talk
Okay.
over it?
She doesn't- Go ahead.
To everyone here from the Korean community, we do have the Korean Community Center in District A in Spring Branch, and so we're happy to work with the Community Center. I know that they do have translation services and other services available, but we'll definitely get with the leadership there and see whatever we can do to assist as well. And if we need to bring in someone from federal and state levels to assist with Medicaid, Medicare, that kind of thing, we're happy to do that. So we'll be in touch with them, and whatever we need to do to assist, we're happy to do that.
Thank you. We're happy to share that with the rest of the Korean members. Did you have anything else?
Thank you very much. And Vice Mayor Pro Tem has a large Korean community in her district, and I know has been very active in providing assistance to that community. Next, we will hear from Myung Jae Kim. HTV engineers are hard at work back there, so I apologize.
Ready? Okay. Hi, I'm sorry. 우리 훈도스 시니어 팀에서 활동하고 있는 김명진입니다. 장수 시대에 들어선 현재 메디케어 수혜자가 올해부터 매년 410만 명씩 증가한다는데 이에 대응하는 메디케어 혜택이나 시니어를 위한 아파트 요양시설이 많이 부족한 현실을 직감하고 있습니다. 저는 현재 스프링 브랜치에 있는 레이크뷰 시니어 아파트에서 노후를 편안하고 안정되고 살고 있습니다. 감사합니다. 여기에 살면서 직접 겪었던 응급 상황을 말씀드리고자 합니다. 입주자 대부분이 혼자 살고 있는 상황에서 어느 할머니가 부엌에서 쓰러졌는데 움직일 수 없고 전화기도 방에 있는 아무 연락도 할 수 없어 그 자리에서 밤을 새웠고 또한 얘는 새벽에 온몸의 고열과 통증으로 고생하면서 소리 지르고 벽을 두드리며 이웃에 겨우 알렸으나 어느 누구도 언어 장벽 때문에 911에 전화를 못하고 있는데 제가 도운 적이 있습니다. 각 세대의 호출을 위한 호출은 있으나 줄 앞에서 쓰러지라는 법은 없으니까 항상 이제 문제가 생깁니다. 이럴 경우 911 호출기를 목에 걸고 있었다면은 긴급히 처리할 수 있었을 것입니다. 많은 시니어들의 안전과 생명이 달려 있음을 생각할 때 모든 거주자에게 긴급 호출기를 제공할 수 있도록 시 예산 책정을 고려해 주시기를 간곡히 부탁드립니다. 감사합니다.
My name is Myung-Jin Kim, and I work as a senior fellow at Buri Juntos in District A. Now that we have entered the era of longevity, the number of Medicare beneficiaries is expected to increase by 4.1 million every year starting this year. And we are acutely aware of the reality that corresponding Medicare benefits and nursing facilities for seniors are lacking. Today, I would like to tell you about an emergency situation I experienced while living in our senior apartment complex. An elderly woman collapsed in the kitchen and stayed there all night because she could not move. Although the phone was in her room, she could not contact anyone. She suffered from a high fever and pain all over her body in the early morning. She was screaming and banging on the walls, but no one could call the emergency 911 line because of the language barrier. Every home has a rope to pull in an emergency situation, but the problem is residents who may live alone may not be able to grab and pull the rope, especially if they collapse. If a 911 emergency pager or resources were available for residents to wear around their neck, this kind of emergency could be taken care of immediately. Considering that the safety and lives of many seniors are at stake, we earnestly request that the City of Houston allocate and increase funding to the Houston Health Department to adequately fund senior assisted apartment complexes and provide resources such as emergency pagers to senior residents. Thank you.
Thank you very much for that. Next speaker is Lee Yoon Ha.
안녕하세요. 제 이름은 이연아입니다. 저는 휴스턴으로 이민 온 지 34년이 되었고 이제 70 중반이 되었습니다. 65세가 되어 메디케어 수혜자가 되었다는 통보를 받았을 때 솔직히 기뻤습니다. 왜냐하면 병원에 가는 게 자유롭다고 생각했으니까요. 그 당시 저는 눈이 매우 나빠져서 도수 높은 안경을 쓰거나 렌즈를 착용했는데 지휘의 권유로 진찰을 받으니 백내장이 심해 수술을 받고 눈을 떠보니 완전 새로운 세상이 보이는 게 정말 좋았어요. 이제는 밤길 운전해도 거뜬합니다. 정말 감사한 일입니다. 그런데 80이 넘은 제 남편이 청력이 많이 떨어져서 보청기를 착용해야 한다고 하는데 비용이 문제입니다. 백내장 수술 비용은 전액 보험 처리가 되는데 보청기는 아니더군요. 전혀 혜택이 없는 것은 아니지만 연금으로 생활해 나가는 분들한테는 거금입니다. 노인증 보청기 사용이 필요한 것은 10명 중 5명 이상입니다. 보청기도 전에 혜택 받을 수 있도록 휴스턴시에서 예산을 할당해 주셨으면 합니다. 감사합니다.
My name is Yoonhwa Lee, and I work with Woody Juntos as a senior fellow in District 8. It has been 34 years since I moved to Houston, and I am now in my mid-70s. I was initially excited when I was notified that I was eligible for Medicare when I turned 65. I thought I was going to go to the hospital, and it would become easier than before. At the time, my eyesight was very bad, so I wore prescription glasses and sometimes contact lenses. But upon the advice of the people around me, I went to see a doctor and found out that I had to have corrective surgery for severe cataracts. Now it's much easier to see at nighttime. However, my husband, who is now over 80 years old, has severe hearing loss and needs to wear a hearing aid. The cost has become an issue. The cost of cataract surgery is fully covered by Medicare, but the hearing aid is not fully covered. For those who do not have pension available or savings, this cost can be very high. More than 5 out of 10 elderly people need hearing aids. I asked the City of Houston to support funding to the Houston Health Department to support long-term and preventative health care needs for seniors who qualify, so things such as hearing aids can be fully covered and easily accessible. Thank you.
Thank you very much. Vice Chair Castillo.
Thank you, Chair, and thank you for being here and for your continued testimony. I want to encourage y'all, if you haven't already, to reach out to the Health Department's Area Agency on Aging. They do have access to translation services, and they are able to assist with these specific type of issues.
Thank you so much. I'll make sure to tell the community members in Korean in an email. Thanks, Mario.
Thank you very much. Next, we'll have Uksun Choi.
안녕하세요. 우리 훈토스 시니어 팀의 최옥순입니다. 저는 올해 71세로 2년 전에 뉴욕에서 휴스턴으로 이사해서 텍사스주 메디케어로 바꾸는 과정에서 영어 미숙으로 많은 어려움이 있었습니다. 메디케어는 연방에서 관장하지만 주마다 혜택받는 서비스가 다르다고 들었고 한국어로 도움을 받지 못해서 당연히 누릴 수 있는 아무 혜택도 이용 못했고 7개월을 허비하고 2024년 메디케어 갱신할 때에는 지인의 도움을 받았습니다. 현재 연방 빈곤선을 조금 넘는 사회보장연금으로 생활 중이고 닥터 오피스의 진료를 받으려 해도 메디케어를 안 받는 의사들도 많고 스페셜리스트 진료 시 코페이 비용도 아주 부담스러워 진료받으러 가기가 겁이 납니다. 최근에 귀에 이상이 생겨서 이비인후과 치료를 받았는데 병원 방문비가 높은 데다 처방약조차 200불이 넘어서 결국 구입을 포기하고 고생을 하였습니다. 저처럼 높은 의료 수가와 비싼 처방약 때문에 현재 어려움을 겪는 노인들이 주변에 아주 많이 계신 점을 인지하시고 이들을 개선할 수 있는 시 차원의 정책들을 개발하시고 합당한 예산 투입을 정중히 요청하는 바입니다. 감사합니다.
My name is Oksun Choi, and I am 71 years old. I currently work for Woody Juntos as a part of the Senior Fellows team in District A. I moved from New York City to Houston 2 years ago and had many difficulties in the process of switching to Texas Medicare due to my limited English proficiency. Because I could not receive help in my native Korean language, I was unable to take advantage of any benefits I was entitled to. After 7 months had passed without assistance, I received help from an acquaintance when replacing my Medicare in 2024. I'm currently living with the use of Social Security benefits that are slightly above the federal poverty line, and even if I try to get treatment at a doctor's office, there are many doctors who do not accept Medicare. The copay costs for specialist treatments are very burdensome, and so I'm afraid to go see a doctor. Recently, I had an ear problem and received treatment, but the hospital visit fee was so high, and even the prescription medication cost was over $200, so I gave up. I could not but endure the pain. Recognizing that there are many elderly people like me who currently are experiencing difficulties due to high medical costs and expensive prescription drugs, I would like to respectfully request that the City of Houston increase funding to the Houston Health Department budget and allocate dedicated funding to seniors like me struggling to navigate the healthcare system. Thank you.
Thank you very much. Next, we'll have Yang Ri.
안녕하세요. 저는 우리 훈토스 시민 참여팀의 일원이며 43년째 미국 시민으로 살고 있는 74살 이향숙입니다. 7년 전엔 집에서 남편이 후진하는 차에 치여서 병원에 입원하여 4박 5일을 있다가 완전하게 치료받지는 않았지만 계속하여 테라피를 받으면 된다고 해서 퇴원을 했어요. 그때 의사의 여러 설명이 있었는데 정확히 이해를 하지 못하고 퇴원 후 가게 일로 바빠 테라피 치료를 하러 안 갔어요. 시간이 지나면 저절로 원상복귀가 될 것이라 생각했었지요. 그러나 결과는 지금도 왼쪽 손가락이 기형이 되어 있고 얼굴엔 뺨부터 입술까지 부자연스러운 느낌이 받으면 된다고 해서 퇴원을 했어요. 그때 의사의 여러 설명이 있었는데 정확히 이해를 하지 못하고 퇴원 후 가게 일로 바빠 테라피 치료를 하러 안 갔어요. 시간이 지나면 저절로 원상 복귀가 될 것이라 생각했었지요. 그러나 결과는 지금도 왼쪽 손가락이 기형이 되어 있고 얼굴엔 뺨부터 입술까지 부자연스러운 느낌이 든답니다.
There has been a request if you are to council members and other stuff. I'm not sure anybody has this, but if you have HTV open somewhere, don't. So, yeah, okay. Continue.
그리고 병원비도 메디케어 보험으로는 완납이 안 되어 비를 받았지만 경제적으로 여유가 없어서
There has
지불하지
been a request if
못했어요.
you are to council members and other
이런
stuff.
경우-
I'm not sure anybody has this, but if you have HTV open somewhere, don't. So, yeah, okay. Continue.
그리고 병원비도 메디케어 보험으로는 완납이 안 되어 비를 받았지만 경제적으로 여유가 없어서 지불하지 못했어요. 이런 경우 시에서 재력이 부족한 시니어들을 보조할 수 있도록 시 예산에 충분히 반영해 주시기를 요청합니다. 그리고 대형 병원을 방문했을 때 영어에 어려움이 있는 시니어 환자들을 위해서 각 병원마다 편리한 언어로 부담 없이 의료 서비스를 받을 수 있도록 각 병원마다 전문 통역사를
이런 경우
각 병원마다 전문 통역사를 채용할 수 있도록 금년부터 예산을 대폭 늘려주시기 바랍니다. 감사합니다.
My name is Kyung-Suk Lee, and I am 74 years old. I am a senior fellow at Woody Juntos in District A and have been living in the United States as an American citizen for 43 years. 7 years ago, my husband was hit by a car and was rushed to the hospital. He stayed there for 4 nights and 5 days. Although he was not completely healed, he was discharged because they said he needed to continue receiving outpatient therapy. There were many explanations from the doctor at the time. We, however, did not understand, and after being discharged from the hospital, my husband returned to work and did not attend therapy as instructed. However, the result is that his left finger is still deformed. That's when she raised her hand up. And his face has an unnatural feeling from his cheek to his lips. The hospital bill was not fully paid by his Medicare insurance, and I was unable to pay it due to lack of financial resources. For seniors who have limited English proficiency and understanding when visiting hospitals, we ask that the City of Houston allocate funding to the Houston Health Department to fund interpreters in person and bilingual staff. Thank you.
Thank you very much. And I'm very sorry about your husband's condition. Okay. Joshua Na.
I'm very glad to see you again.
We're great. Buenos dias.
Thank you. Thank you so much. 휴스턴에서 5년째 살고 있는 75세 호수의 나입니다. 현재 우리 훈토에서 근무하고 있습니다. 3년 전에 저희 언어 이해 부족으로 인해 병원에서 겪었던 일화 한 토막을 소개할까 합니다. 위와 장 내시경을 동시에 받을 줄 알고 병원에 갔더니 위 내시경만 한다는 말에 전날 밤 장을 비우기 위하여 하재를 마시고 고생했던 일이 생각납니다. 위 내시경만 한다는 말만 이해했더라면 굳이 그런 고생을 하지 않을 것을 생각하면 지금도 기분이 쓸쓸합니다. 휴스턴에서 약 1만여 명의 한국계 노인들이 살고 있습니다. 그들이 병원을 찾을 때 저희 경우와 유사한 문제로 어려움을 겪는 것이라는 것을 충분히 짐작할 수 있습니다. 시의원 여러분, 노인층이 점점 증가됨에 따라 저와 같은 의사소통이 어려운 겪지 않도록 지원해 주시기 바랍니다. 이를 위해 보다 많은 병원에서 필요시 한국어 통역사회와 대면 대화를 통해 좀 더 수월한 진료를 받을 수 있도록 휴스턴시 예산을 편성해 주시기 요청드립니다. Thank you so much.
My name is Joshua Mansikna, and I'm 75 years old and have lived in Houston for 5 years. I currently work at Woody Juntos in District A. I would like to speak about my experience I had 3 years ago due to my limited English proficiency. I went to the hospital under the impression I was receiving a gastroscopy and intestinal endoscopy together at the same time. However, when I arrived at the hospital, I was told I was only receiving one procedure, a gastroscopy. I began to think of the hardship I went through the day before to clear my
semicolon. I still feel bitter when I think about what I would have gone through and this trouble I went through if I understood the procedure that I was having. About 10,000 Korean seniors live in the greater Houston area, many whom have limited English proficiency and struggle with problems similar to mine when they have healthcare visits or procedures. City Council members, as the elderly population continues to grow, I ask for your support so that they may not experience communication difficulties as I did. It can be very dangerous. I ask the City of Houston to allocate more funding to the Houston Health Department budget so patients can receive better treatment through face-to-face conversations with Korean interpreters and with necessary bilingual staff. Thank you for listening to me.
Thank you very much for coming, sir. Thank you. John Kim.
Hello, council members. My name is John Kim, community organizer of Uri Juntos. A few days ago in Houston, severe climate changes have led to widespread power outage, leaving many areas without electricity, as you know. This situation has caused a great inconvenience for residents, and some areas have reported fatalities and injuries. Unfortunately, some of our senior community members collapsed due to the extreme high temperature at home. In this circumstance, we also opened a cooling center at Korean Community Center from last Sunday, where people can rest with some drink and injuries, snacks while charging their electronic equipment. Also, we can easily expect that insect bites, acute respiratory infections, pregnancy complications, and intestinal infectious disease, including post-traumatic stress disorder, major depressive episode, and generalized anxiety disorder, etc., you name it. Will follow afterwards, I think. Recent global climate anomalies have caused severe weather disaster in many regions. The United States, China, Russia, the Middle East, Asia, Africa, and Europe are among the diverse regions affected by these climate changes. I believe this indicates that Houston cannot be an exception at all, and the disaster situation that occurred recently in Houston can only be seen as a substantive evidence of that. And I heard that the director, the Michael, said we have to expect that the frequencies of this kind of disaster will increase annually. So I fully agree with that. It means that we may easily expect that this kind of disaster can repeat monthly or annually, not in a decade or a few decades, in view of a current climate crisis, and the health condition of Houston residents can worsen and worse. The most vulnerable groups to these extreme weather events are inevitably the poor, and among them, seniors with health issues are likely to be the hardest hit. The poor have limited access to resources and support, making them more susceptible to extreme weather conditions. For example, during power outage, they may be unable to use heating or cooling devices, which can be fatal. Seniors with health problems are particularly sensitive to extreme temperature changes. posing serious health risks or even life-threatening situations. From this perspective, I request that the city's budget be appropriately allocated to ensure that those Greater Houston residents also can maintain their health.
Thank you, Mr. Kim. Can you quickly wrap up your remarks?
Okay.
Thank you.
One sentence. Of the long term by preparing well-organized systems, for example, coalition with many non-profit organizations in every community for the unexpected possible disasters. Thank you.
Thank you very much, and thank you for your advocacy. Final speaker is Hunja Norman.
Hello. 안녕하세요. My name is Hunja Norman. Good to see you, Council Member Amy Peck. I'm the Executive Director of Urihuntus, located in the Korean Community Center in District A, Spring Branch. I have been a homeowner in Harris County for more than 20 years. First, I want to thank the City of Houston for translating the 2025 budget workshop presentation into Korean. This is a big win for our community because we showed up and asked for it. The city is listening to our need. Our community, like many other immigrant communities, face challenges. Many first-generation Korean Americans speak limited English and struggle with health issues. Language barriers make it hard to access resources like healthcare services. For example, a Korean senior called me in severe ear pain. She needed a doctor, but she did not know where to go. She lives alone, seems to have early dementia. I am very worried about her because she might not know how to navigate the system. The Houston Department of Health in the website said they provide help to all residents. But in real situation, the only one who needs real help never is aware how to get help. I feel much more outreach to vulnerable population is needed. In the United States, over 38 million people have diabetes, and 1 in 3 adults have pre-diabetes. This risk goes up with age. Also, about 9.1 of Asian American adults have diabetes. I want to help my community learn how to manage and control diabetes. On your HHD website, the Diabetes Awareness and Wellness Network offers support in certain areas and languages, but help to Korean and various other languages and communities were not available. We need more language access and investment in community education and outreach. We ask the City of Houston to allocate funding to the Houston Health Department to expand education initiatives like DAWN and include Korean and other language support. Thank you.
Thank you very much. And thank you once again, Sarah, and all the Korean community members who have showed up. It means a lot. And thank you for the health department staff who has stayed to hear their concerns. And I really appreciate your advocacy. Thank you. Okay, everybody, we're going to take a 5-minute break while we figure out what the heck's going on with this audio situation. And we will move, I'm sorry, we're running a little bit behind, but all these questions are really important. We will next move to the Solid Waste Management Department's budget presentation.